Verbal and nonverbal communication shape how patients and other team members respond to messages. This video begins with a patient sharing how a conversation was shaped by her physician's nonverbal communication.
My name is Tara Rouse, and I'm from Raleigh, North Carolina. I've had a number of different experiences with healthcare organizations. As a patient with chronic health conditions, as the mother of a child with special healthcare needs, as well as a family caregiver. One of the more significant experiences I've had in healthcare was after I had a heart attack at the age of 40. I was briefly hospitalized and then was sent for a follow-up appointment with a cardiologist. I remember walking into that building for the meeting with that first cardiologist for the very first time. My husband had come with me to make sure that I asked all the questions I wanted to and got the answers that I needed. We both walked away feeling like he had been very dismissive. And a lot of that came through nonverbal communication, lack of eye contact, no leaning in happening. And he also seemed to be very distracted by other things, checking his phone, returning text messages, checking alerts on his watch, all the things that made me feel like he wasn't listening to me.
Tara's primary care physician recommended a different cardiologist more focused on partnering with her patients. That initial conversation went very differently.
Having all of my concerns addressed was so important to me, and it's exactly what I got with the new cardiologist. Walking in and starting the questions in the conversation, I knew right away she had read my chart. She had a basic understanding of what was going on with me, what had transpired. She, throughout the visit, asked me to use my own words to explain what was going on and made sure to not make any assumptions about anything that I was feeling or experiencing. She listened really attentively, using all of those amazing nonverbal communication skills, leaning in, letting me know she was there with me. And one of the things that's so important too is that she would summarize what she had heard me say and check in to make sure that she had gotten it correctly. She would also make sure that I had really understood and absorbed everything we had talked about. So, for example, with next steps, she would kind of summarize and say, "I know we've talked about a lot, Tara. Tell me in your own words what we're going to do next." So using those teach back techniques to make sure that I had a clear understanding of what the plan of care was, what was happening next, and for her to do that double check to make sure that she had explained things in a way that I got it rather than just having me say, "Yes, I get it." So that repeating back was so important and a good way to let me know not only was she listening to me, but that I knew exactly what the plan was moving forward.
Technology can either undermine or enhance communication in care teams. The key is in how the technology is used.
So technology is here to stay. I cannot think of an appointment that I've been to with a provider where a laptop or tablet or some sort of device has not been a part of it. However, when I think about that first appointment with the cardiologist and how technology was used, where he was responding to a text, looking at his watch, on the phone, it really served as a distraction so that he was pulling his attention away from me and to the device. And as a patient, I really wasn't aware of what he was attending to that device for. Was it related to me and my care? Was it another patient emergency? Or was it something that was personal that was going on that he was being pulled to there? That said, I think about the appointment I had with my second cardiologist that I went to and how she used technology, and that it really was a tool for communication between the two of us. So she would refer to something on the laptop and say, I read here that it says this. Is that still the case? And so she was using it to make sure that what was in my chart was accurate, that she had the picture correct, that current state was still as it had been last time my chart had been updated. She would also let me know when she was going to add things in my chart. So if we would talk about something and it was new or a new goal or part of a plan of care, she would say, I'm going to add that in your chart right here. So again, she's using it as a tool to ensure that everything in there is timely, accurate, and she's letting me know through these conversations exactly what she's using that technology for. There's no question about why she's on the laptop or what she's doing on a tablet. She's being very transparent about that, and so I think that's the difference, and why technology can actually become a bridge between providers and patients rather than being a detriment.
Can communication between healthcare providers and patients on their teams be improved?
A number of years back, I read an article that said patient engagement is a skill, not a trait. I think so many times we make the assumption that when it comes to patient engagement, providers are either really good at it or maybe it's just not their thing. And I would love for that belief to shift so that we feel like this is something we can all do and all do well. It just takes purpose and intention. And there are so many tools and resources out there that can help all of us, all of you as providers, become exceptional in patient engagement.
Team steps tools exist to foster better communication in care teams, including communication with the patient and family caregivers. Other patient stories in the entire Team Steps curriculum are available on the AHRQ website.